For millions of individuals diagnosed with end-stage renal disease or acute kidney failure, the word dialysis can sound intimidating. However, modern dialysis is a highly advanced medical treatment that helps perform some of the essential filtration functions normally carried out by healthy kidneys. To understand dialysis, we must first look at how the machine connects to the body. Before regular hemodialysis treatments begin, many patients undergo a procedure to create a vascular access site, often called an AV fistula. This access allows blood to flow safely and efficiently between the body and the dialysis machine. During treatment, one needle carries blood from the body into the machine, while a second needle returns filtered blood back into circulation. Once blood enters the dialysis machine, it flows into a component called the dialyzer, often referred to as an artificial kidney. Inside the dialyzer are thousands of tiny hollow fibers. Blood flows through the inside of these fibers, while a specially prepared dialysis fluid flows around the outside. The walls of the fibers act as a semi-permeable membrane. Through natural diffusion, waste products and excess substances can move across the membrane into the dialysis fluid, while important blood components remain inside the bloodstream. This process helps reduce the buildup of toxins that would otherwise accumulate when kidney function is severely reduced. At the same time, the dialysis machine can remove excess fluid from the body through a carefully controlled process known as ultrafiltration. This helps reduce fluid overload and supports healthy circulation. Throughout the session, the dialysis system continuously monitors treatment parameters to help maintain patient safety and comfort. Long-term dialysis treatment can represent a significant healthcare burden in many countries. Some international patients explore treatment options in India, where JCI-accredited renal centers provide advanced dialysis services, experienced nephrology teams, and modern kidney care programs at substantially lower costs. Although dialysis requires commitment and ongoing medical supervision, it helps many individuals maintain daily activities and quality of life while managing severe kidney disease. Always consult a qualified nephrologist to determine the most appropriate treatment plan for your individual condition. Knowledge is your best tool when protecting your health. Subscribe to Cure in India for more honest, data-backed medical insights and healthcare guides.